You make my world a better place.
Yes!
He's walking with me.
I can depend on
If you were to ask me what my favourite animals in the world are, then one of them would have to be the cheetah. We don't get too many of them coming through the doors at Bondi though, so when the opportunity came up to see a 3-month-old cub, I wasn't exactly going to say no.
Chris is an hour from Adelaide at Monarto, Australia's largest open-range zoo. Waiting for him there is a very special baby. She's about to sit the biggest test of her life.
Hey, how are you?
Going good. Nice
I'm
to meet
Chris.
you.
How
I'm
are
Michelle.
you? Hey, Michelle.
Welcome to Monarto.
Thank you. It's the big day.
Yeah.
Little girl's leaving home to become a
Yeah.
star. Oh, wow. Hey, little one.
Here's Quatili.
Hey, Donna. How you going?
Great, how are you?
Good. I walk in and my first reaction is, where are they hiding the batteries? She cannot be real. She's ridiculous. Her name is Quatili and she's being hand-raised because her mum just ran out of milk.
Quatili means regal princess in Swahili. She's the first cheetah to be born at the zoo in 8 years, and keepers Michelle and Donna are now the cub's surrogate mums.
We share a really special bond with Quatili. I've worked with Cheetah for a lot of years, sort of focusing on them and their breeding. And to finally have one little cheetah cub born is so special, knowing that they're so endangered. They're Africa's most endangered big cat. So to be able to spend time with a precious little cheetah cub makes you very thankful.
That's a good girl.
Today, Chris is getting involved in the daily training of the baby, and that includes meeting strangers. 6'5" blonde strangers.
She's handling me being here.
Yep, she's doing very, very well. She's accepting that you're stroking her and it's not worrying her at all. And that's really good and important for us to do veterinary examinations on her in the future.
There are big plans for this little one. The keepers are hoping that she'll become the poster girl for Adelaide Zoo. She'll educate the public about the plight of the cheetah, but she'll also do meet and greets with people. To do that, she's going to have to pass some tests. And Quatili's exams, they start today.
Push.
In the New South Wales country town of Maitland, 16-week-old Mitzi is getting ready for her life-changing journey to the Bondi Referral Hospital, SASH. She may appear to be a normal kitten, but there is something terribly wrong.
To see her when she twitches and if she has a seizure, it's so scary.
Hello, Puss.
It's like having a baby again. She's very, very loving.
Mitzi had a tough life from day one. Dumped as a baby, she was taken in by Melita's daughter Jessica and her partner Chris, who run a private rescue shelter for cats. When they took the orphan in for a routine microchipping, Mitzi's luck took a turn for the worse.
Pretty much as soon as the needle went into her neck, she had a really violent seizure.
She spent about a week and a half completely paralysed down her left side. So she sort of eventually, she started getting a little bit more movement, but at first we were hand feeding her and dripping water into her mouth with a syringe.
Good girl.
Really scared for her, really. She's so little.
Push.
Melita believes there is a link between the microchip and the kitten's serious issues.
Vets that we've taken her to have all said, oh no, it couldn't possibly be the chip. Never heard of it, couldn't be the chip. But I don't know, there's got to be a reason.
She right? She gets really upset coming outside. She's not used to it, so she gets really scared.
Do you want your mum?
Show me.
Where's your mummy?
Now she and Jessica are on their way to SASH to see specialist surgeon Andrew Marchevsky.
I'm actually scared that the chip is in the wrong spot, and I need to find out so that if it is, we can move it.
At Monarto, Quartieri is about to be road tested. The baby cheetah is earmarked to become a meet and greet ambassador at Adelaide Zoo, but she needs to cope with the 1-hour car journey and exposure to the public.
Today is an incredibly big day. We have been working very, very hard with a team of people to prepare Quartieri for this process. So we're a bit nervous about how that's all going to go.
So if today's going to go well, Zebby's going to play a big part.
Absolutely.
Zebby keeps Tilly calm during the car trip.
Yeah. And this is the ultimate karma.
Keeps
It's an interesting mix. Mothers at home with kids, having trouble getting down to the local shops. Just need these. So now we'll get her into the box.
Yep.
Guys nervous?
No, all good.
Yeah,
She'll be
give you
fine.
a calm face, I
Yeah.
like it. All right, Tilly, come. Zebby's in there. Cool. So is this. Here we go. All right. And you got a big day today. You're leaving home for the first time. Clearly, Tilly's not one for nerves, but in the big scheme of things, today's big. So it's probably good not to waste any of that nervous energy right now.
To travel with Quartieri down to Adelaide Zoo can be a stressful situation because you've got an animal which is very much wild, very instinctual. Put into a pet pack, hearing noises and seeing trucks go past and things is different for her. So, yeah, we'll see how she copes with it. So if you just, face her that way.
Face her
in. Yeah.
Face her in?
Yep. That way. You can sort of sit in there with her and she can look out and be reassured by one of us.
Okay, ready to go?
We're ready.
See you in Adelaide. This is really make or break for Quartieri right now. If she freaks out in the car and can't make the journey to Adelaide, she just can't be a part of the program.
At the Bondi Referral Hospital SASH, Melita and her daughter Jessica have arrived with Mitzi.
I wonder what he'll say about you.
The rescue kitten is struggling to walk since being microchipped.
I suspect maybe the chip's pressing on something it shouldn't, and we'll find out.
Just pop on there for me. Hey, Mitz. Oh, dearie me. There you go. Oops. So what happened?
When she was microchipped, she had a bit of a fit.
Anything else? Was
And she was paralysed.
Oh, okay.
She spent then almost 2 weeks afterwards. She couldn't move down her left side.
Sweet. Well, you go on the ground? Oh, sweetheart, you're all right. Don't panic. What you going to do? Oh, gosh.
She actually can't walk in a straight line.
Yeah, no, feed her.
Yeah.
Mitzi's obviously really unsteady on her feet. One side's much worse. She's got really sort of exaggerated, uncoordinated movements. Back legs, she's sort of all over the place. So she's got some sort of spinal cord injury. You know, I guess one possibility is that chip sitting near the spinal cord or...
Yeah, we've been assured that it couldn't be, that it's never happened.
I guess, but I'm thinking, you know, has she got a congenital problem that's been exacerbated by a sudden movement when the chip went in? And I guess that's why we need to do a CT.
It's a bit sad to think that we're just going to leave her here and she won't know where we are or what's going on.
Look after her for me.
I promise.
See ya.
In South Australia, Chris has arrived at Adelaide Zoo with the precious 3-month-old Quartieri. The baby cheetah has passed her first big test.
You've got to remember, this is the first time that Quartieri has ever left her home at Monarto. She's a wild animal. It's not normal for her to be inside a car, but It's incredible how well she's handled it.
Not missing home yet, are you?
Now, an even bigger test. How does she handle a totally new enclosure?
Hi guys, how are you going?
How you going? You're the welcoming committee.
Yes, I'm the welcoming committee.
Thank you.
Today, Quartilia is auditioning for a role as an ambassador at the zoo, where she will interact with the public. But she needs to cope with the new environment.
You guys ready?
Sure am.
This is it.
So what we're looking for is her to walk out and just be calm, prowl around, but just generally seem quite happy. Is that?
Absolutely. Here we go.
There you go. Hey, straight between the legs. It was the quickest way.
She's loving that.
So if she was stressed, she wouldn't be playing. Yeah.
She's having a wonderful time.
She's taken fabulously. She's running around like a little cheetah should at this age and playing and having a ball and totally relaxed.
The crucial thing here is that she's able to follow and really listen to her keepers. It's almost like a cheetah version of puppy training, but if they don't get it right now, then when she's fully grown and really able to cause some damage, it could get really dangerous.
All right, and now ask her to sit.
Sit. Sit, Tilly. Sit.
The reason that we're doing the training is so that people can get up close and personal with this cheetah, so that she will sit and she will come when we call her, and we can allow people then to go in with her and have a wonderful experience of meeting an endangered species.
I said good dog, that's awkward. It's exactly the same as dog training though, isn't it? I'm sorry, Tilly, you're very different. Quartilia is following those commands really, really well. I mean, you have to remind yourself that she's a cheetah. She'd put some chihuahuas to shame.
Quartilia.
If she was to go on to become an ambassador for Cheetah, I have no worries that she would be awesome and be a little star for sure, because she already is. She's just fabulous.
You look at Quartilia and she's still so young and so innocent and so naive to the problems that the rest of the species is facing. But you look at her and you realise they've got a pretty good ambassador there.
You're all right, Cheetah. You're all right. Can I have your little leg?
While Quartilia's future is looking good, back at Sash, 16-week-old Mitzi's fate is still to be decided.
The veins are just going to be so small.
The kitten has now been given a CT scan to find out if a misplaced microchip could have caused spinal damage.
No, no, kitty cat. We've got to be careful in the CT with positioning her. Normally we have them positioned on their back with their head stretched out. You have to be really careful if she starts moving around a lot. Again, could cause damage, so it's really softly.
It's a tense wait for Mitzi's foster family.
I just want to find out. I'm anxious to go in there and find out.
Well, I mean, it's freakishly unlucky. The gap between, bloody hell, the gap between the vertebrae is tiny.
There is now proof the microchip is wedged in Mitzi's spinal canal. The odds of it happening are astronomical, more than 1,000,000 to 1.
No, never seen anything like that. The needle has sort of gone bang straight through that little gap there. I mean, that gap's not even 2 millimetres. We need to take it out. We know that she has these paroxysms of pain or whatever, or seizures, so then occasionally it hits a nerve and she just flips out, so we've got to stop that.
After agreeing to surgery, Mitzi's foster family are coming to terms with the severity of the news.
Do you think that she will learn to walk properly again?
Can I give you a 100% guarantee of that? No, because life's not like that.
It's amazing that it's gone right through the spinal cord. I can't imagine how this poor little thing feels.
There could be a dirty big blood vessel sitting right around it. We take it and it bleeds like crazy. It's not likely, but it's possible. In a worst case scenario, she will be permanently worse. This thing could be sitting in or on a blood vessel, and if we move it, take it out, she could bleed out.
Specialist surgeon Andrew Marchevsky is about to start the critical surgery on Mitzi.
Small possibility, but a real possibility is that we could make it worse. And I guess that's where we're taking a risk, but I think we have to take a risk because she's intermittently, I think, incredibly painful, and that's what these seizures are. They're just paroxysms of pain. You good to go? It's got a lot of blood vessels in the muscles of the neck, so especially with this little cat, we've got to be really careful not to lose too much blood because she really doesn't have a lot to spare.
So what's the story of the peccary today?
Yeah, his peccary's been a bit lame for quite a while now, on and off, and we think that his hooves are overgrown, so we need to get our hands on him to check that out and see what we can do about it.
Sounds easy. It's not going to be easy, though, is it?
At Adelaide Zoo, Chris's second appointment is with a very strange-looking creature.
So, the peccary. Never heard of one? Well, there's only 10 in Australia. 3 of them are at Adelaide Zoo. They are aggressive little units. Not much bigger than a wombat, but their teeth, they're bigger than a lion's.
Percy's 17 years old and the senior citizen is struggling to walk.
So the issue's been just what the nails are overgrowing.
Yeah, that's the main thing that we're looking at. He's been walking a little bit oddly at the moment, and overgrown nails is one of the main things that we can identify remotely that might be causing that. So getting our hands on him to have a good look at those, give him a bit of a hoof trim to boot.
So our boy's got to get a bit of a manicure and pedicure, huh?
Indeed, yeah.
Doesn't look like the type that would really enjoy it, though.
Well, sometimes you've got to grin and bear it.
Listen to that sound. I've never heard anything like that before in my life. It sounds like a machine gun. And essentially means the same thing. Back off.
The hoof trim is scheduled for tomorrow.
What's the plan? How are we actually going to get them down so we can trim these nails?
Certainly go in with a dart gun to get our hands on them. I'm not really about to approach them without that, and if you want to, then be my guest. Yeah, they are dangerous animals. We don't work in with them at all. We certainly have a healthy dose of respect for them. As I said, they're really hard to defend yourself against. They're really fast, they're strong, they've got sharp teeth, and they could really do some damage to you.
You there, Lisa? How do you know little Gizmo has arrived? The little toxicity?
At SASH, 3-year-old Cavoodle Gizmo has been rushed in, suffering from constant tremors.
My sister called me and she said that he'd vomited and to come home and clean it up right now. And then I got home and we couldn't find him anywhere, and usually he rushes straight to the door and he wasn't there. And he was outside in the garden, like beside the house underneath the boot, and he was all in the mud and vomiting. So it might be he's eaten something, but we don't know what he could have eaten. So, and then rushed straight here.
Pretty worried.
He's all shaky and twitchy.
Well, this is basically our practice baby. Really. So, yeah, pretty invested.
Hello, I'm Lisa. Hi. Lisa, nice to meet you. Hi, Sarah. Hi, Gizmo. Oh, shaky, darling, come through. Can pop him down on the ground and we'll just have a chat first. So I want to see what he can do. Not having fun at all. He's not a happy boy. Gizmo, Gizmo.
Come here, buddy.
Come to us.
Emergency vet Lisa Chimes is worried Gizmo may have been fed a poisonous bait.
We often see dogs that bark a lot and people try and poison them. So I guess at this stage we have no idea what's causing it.
You hear about that happening all the time and it's so sad. You hope for at least a phone call or a talk about it first before anyone resorted to anything that horrible.
Let's have a look at your face. You're okay. You're okay. That's a good boy.
I'm really worried that Gizmo's been poisoned, and the problem is that if he's got a toxin in his stomach, it's going to get into his system really, really quickly. So we've got to act fast to make sure that we can save this little guy, because I'm really worried that time's running out.
Emergency vet Lisa Chimes is hoping a series of tests will provide some answers.
Good, Gizmo. Good boy.
After putting Gizmo on a drip, Lisa injects the Cavoodle to make him vomit any toxins from his system. No clues there. Now Gizmo has to be tested for illegal drugs.
If he's picked something up that somebody's thrown over the back fence, or if he's picked something up on his walk, methamphetamines, cocaine, opiates, marijuana, I'm hoping that we get a negative result.
Good boy.
An enema is just another indignity for the miserable Cavoodle.
What we're trying to do is get any toxin out, and hopefully once we remove it, it's going to alleviate some of the signs and also hopefully give us some clues as to what's going on. A job well done, nothing found.
With all the test results still giving Lisa no answers, she decides on one final treatment.
So I'm giving Gizmo some activated charcoal, and what that does is it binds to any toxin that's still in his gut, and it's going to prevent it from being absorbed. Swallowing.
Good boy. Just tastes like dirt. Come on, honey, swallow it. Good boy.
Here we're making a mess.
Lucky you're a black dog, because nobody can actually see what a mess I've made of you.
Just pretend like it's just part of his coat. In your hop. I've done everything that I can for Gizmo, but he's still shaking. We just have to wait, and hopefully we've got everything out in time. We just don't know.
You have a good little sleep, honey.
There's quite a lot of blood vessels in the muscles of the neck. So especially with this little cat, we've got to be really careful not to lose too much blood, because she really doesn't have a lot to spare.
In the operating theatre, surgeon Andrew Marchevsky is trying to remove a microchip lodged in the spine of 16-week-old Mitzi.
I guess the other thing that we've got to be really careful of is that as we're dissecting down, we don't dissect down directly onto the chip and maybe push it in further or cause more damage. So it's just got to be patient and meticulous. We're just starting to peel the muscles away. Not quite sure what I'm going to grab it with.
After an hour in surgery, the critical moment has arrived, removing the microchip without causing any permanent damage.
Let's see if we can grab it. You just turn that sucker up. Thanks.
Waiting in reception, Mitzi's foster family are hoping they've made the right decision.
Really anxious. I just want someone to come out and tell us that they've got it out and that everything went well. Yeah. I guess no news is good news for the moment.
I can just see the tip of it, and I think we should be able to just grab it and pull it out. So there we go. Bingo. That came out really nice.
Andrew must now reposition the microchip.
We've re-implanted the chip into just under the skin to where it should be. It's really important that animals are microchipped. It is such an important way of identifying them and making sure if they get lost, they get their homes, and it's part of responsible pet ownership. I still say this is a 1 in a million sort of risk, which is just really unlucky. I'll be hopeful that we haven't caused any more damage, because it's come out pretty nicely and we're really careful, so I guess we'll know when she wakes up. Hey, chitty chat. Don't look at me like that. Eh? We're just doing the good stuff. I know you're really keen to see her, but I think you'd be better just waiting until tomorrow, and then you can see how she's going there.
There will be no visitors for Mitzi tonight, to make sure the kitten stays as calm as possible.
Well, upsetting for them, upsetting for her. I guess I'm mainly concerned about her, so they're going to have to just tough it out for a bit. And I think we've given her the best chance of getting back to totally normal. But, you know, we're not going to know tomorrow, next week, or even next month. Time will tell. Hey, little one. Oh, sure.
So we'll make up a dart. We've got a few drugs here that we need to draw up to get into the beast.
Next day at Adelaide Zoo, Chris is ready to take on the aggressive Percy. Overgrown nails have made the peccary lame. An urgent hoof trim is needed.
So we're not going to send Chris in unprepared. We're going to set him up with some good drugs and a dart pistol so we can get those drugs into him remotely and hopefully keep him well out of harm's way. So have you had much to do with peccaries or wild pigs before?
Yeah, I haven't done much with peccaries, but wild pigs and I have a fairly colourful history together.
Oh, good.
When I say colourful, it's never really ended beautifully. You shouldn't be put off by that, but yeah, we've had a few run-ins. First, there was Miss Piggy, 175 kilos of Fijian porker. She was a big girl and she was a bad girl, and I had to convince her that she desperately needed a pedicure.
We had fun, didn't we?
Kind of cute. And then there was Lola, sweet Lola. She needed a nose ring, but gave me one hell of a run around in the process. This is a pretty special cocktail of drugs, so I'm hoping it's going to be enough to send Percy to sleep. But you never truly know until you're right next to him.
G'day, Henrik.
Hi, guys. We're
Hey,
ready for you.
Henrik, this is Chris.
Hi, Chris.
He's giving us a hand with our peccary today.
They're your kids, are they?
Yeah, my kids, yeah. He's not very happy, but we're ready for you.
He's doing some funny breathing and chattering of his teeth.
Chattering, yeah. That's trying to scare us.
Right, he's in a good spot now. Just got to wait. Just waiting for him just to spin around and just show me his backside. That's where I need to go. Steady, buddy, steady. You see that? It's just bounced off his rump. It's just a really thick skin there, so it's gone in and just basically just rebounded straight off just because there's so much muscle and the skin there is so incredibly tough. So, same drugs as before, just what we're going to do is just add a little bit of extra power, a bit of more oomph. So we just put a bit more gas into the actual dart gun itself. That should make the difference. It's going to be a lot more wary now. So this shot really has to make it. Yeah, got it. Yeah. He's just running around a lot now just because he can feel the dart in his leg, but he'll start to settle in a little while, and once he settles, those drugs should start going into his system and hopefully he should be down pretty soon. It looks like the anaesthetic is taking effect, but we can't begin this procedure until we're 100% sure that he is asleep. If we go in there and he's not, we're all in really big trouble. He's looking pretty close to being down there.
Yep, I reckon we're just about good to go in, Chris. So if you want to choose your weapon of choice and let's trust our anaesthetic.
We'll take the big broom. All right. See him through here?
Yep.
So I can tell how deep he is just by tapping near his eye. And he blinks, but he's not shaking his head or doesn't seem too aware of that. There's a little bit of urgency in doing these nail trims because we just don't have that long with him under anaesthetic. Percy's an older peccary, so the less time he's under, the better off he's going to be.
Jeez, look at those. They're incredible, aren't they?
Now he's asleep, I can have a look at those teeth. They are weapons. Each time they bite down, they create a sharper and sharper point. It's no wonder the keepers won't get in with Percy.
Hey, Mitzi. How you doing? You're pretty good considering.
It's only 24 hours since surgeon Andrew Marchevsky removed a microchip from Mitzi's spine. There was a risk the operation could cause the kitten more damage, but early signs are positive.
I thought she'd be worse. When you're taking something away from the spinal cord that's been sitting there a while, just that's what happens. She's actually better. I couldn't be happier.
We haven't made you any worse. That's a good thing. Whoopsie. There you go. So you're looking a little bit better today. That's a bonus. Hey, I think you're more comfortable.
And she's still wobbly, she's still weak, but that'll get better. And she's got age on the side. You know, when you're young, you can recover and recuperate from trauma much more easily, and she will.
Okay, you're more active. Hey?
Come on, we'll get your mums to have a look at you.
Andrew's now finally relenting and allowing Mitzi's foster family their first visit.
She's looking really good.
Is she?
Yeah, I think probably better than I thought she might be.
Oh, that's good.
So I think you'll like what you see.
Oh, good.
Come on, look.
Yes, please.
Yeah, really? In all seriousness, she's just got a look of relief on her face. It's like, oh, you know, and now I can do stuff. Yeah, so, no, and she has surprised me.
I've been spent all day preparing myself for her to be as bad as she was when this first happened. But she's doing really well. So much better than I expected.
I think she's actually going to be quicker than you think she's going to be. Just be wary of that.
Despite the impressive recovery, Mitzi will have to stay in hospital for a few more days for observation.
Amazed that she's as good as what she is. I fully expected her to be, I don't know, either paralysed or, I don't know, flat on her back for a week or so. So to see her up and walking around is amazing.
Don't you hit me?
So yeah, his feet are obviously pretty long. It's mostly those outside claws on each foot that I think we need to focus on.
At Adelaide Zoo, Chris still has a long way to go with Percy's much-needed pedicure.
Really the problem has been the fact these nails have been so long that he's really been tripping over them and he hasn't been able to walk in a normal way. He's had to really adjust the way his feet are sitting on the ground to accommodate these massively long nails. They're almost like a pair of shoes that's way too big for him. So because of that, he's had to alter the way he walks, which has caused a bit of secondary arthritis and a bit of lameness. Having this done for him right now will make a huge difference. All that pain, all that discomfort's going to disappear and he's going to be wearing shoes the right size.
While Percy's out for the count, Chris gives him an anti-inflammatory injection to help combat his arthritis.
The final little injection should make his walking a bit more smooth. There we go. I think his hair was that way. How was it?
Up. Well, you're the hairman, Chris, I don't know.
Gee, everyone's an expert around here, aren't they? Everyone's sticking the boot in while they can. I've seen that teeth chattering. I think the better we can leave his hairstyle, the happier he's going to be. Okay. Carrying through. So you happy with this here?
Yeah.
It's going to move a bit quickly here.
No, he's had his reversal drugs. We'll just leave him quietly by himself to wake up calmly. He could wake up any time, really, in the next 5-10 minutes, and it can be quite sudden, so we want to be sort of well out of the road when he does that.
Gizmo! Gizmo! Gizmo, you look so much better. Huh? Let's see how you walk. Let's see how you walk.
At SASH, Gizmo has made an incredible recovery.
You're all better! Gizmo, Gizmo, Gizmo! Who got fixed? Who got fixed?
The 3-year-old Cavoodle is showing no signs of the shaking and tremors that had taken over his body when he first arrived.
We ruled out a lot of things, but the exact cause of what happened to him will never be known, huh, Gizmo? It's a bit of a mystery.
After everything from an enema to a drug test, Gizmo is just happy to be going home.
Come on. Come on, Gizmo. Gizzy! Gizzy! Hello, puppy. Hello, puppy. Hello. Oh, are you okay?
You look much better.
Yes, you do. Yes, you do.
Thank you
so much.
No problem at all. Hey, buddy? And you don't get into anything else, hey? You got to tell your mum what you get into next time.
His breathing's starting to pick up a bit. He's just starting to come around now.
At Adelaide Zoo, Chris is waiting for his weird patient to wake up from the sedation.
This is always a tricky time. I want to hang around long enough to make sure he's okay, but when he finally does wake up, he's not going to be happy. He's going to go looking for the guy that put a dart in his behind. And that person was me. Yeah, he's just starting to stir now.
Yeah. Welcome back to the world, buddy.
Yeah. All right, you can just see he's just about to stand up now. Yeah, okay, he's up now. So he's a bit wobbly, but he's up. Easy, buddy, easy. You can just see he's come to, he's just a bit confused. You can see, even though he's able to stand up and move around, he's not really doing much coordination, even with his new shoes.
This is the best part of the procedure, knowing that we'll wake up the other end and everything's gone well. So.
It's a good result, and I've got to say it's been amazing being that close to what is a pretty bizarre creature. Having said that, I don't think he'll be sending me a Christmas card or a birthday card. I did mention it was my birthday, didn't I? No? At least someone remembered.
Happy birthday to you. Happy birthday to you.
Thank you.
Happy birthday, dear Chris. Happy birthday to you. Hey! Hey!
Wow. You know it's tomorrow.
Oh, happy birthday for tomorrow.
No, I'm joking, it's today. I'm a bit disappointed though. This is the first time I've ever done anything involving anything close to a pig and not been bleeding, sweating, cursing, and leave with my pride destroyed.
Sorry to disappoint you.
Good job though.
Thanks,
Thank
Chris.
you. No worries.
Thanks, Chris. Cheers.
Thanks very much. See you, buddy.
Oh, is she?
As for Mitzi, she's ready to start a new life. It's been 3 days since the risky surgery to remove a microchip that was accidentally lodged in her spinal canal.
So is she right just to run around and do what she wants to do?
Oh, look, with any major surgery, you should take it easy. So if you can limit how much charging around she does. You know, she's not going to do any damage to a spinal cord, but she might sort of cause some bruising or swelling, which you don't want. So, yeah.
I think she's getting so adventurous now I'm going to have to line the house with pillows.
For the foster family who used up all their savings to pay for the orphan's operation, it's a huge relief.
We could have left it there because of the expense, but if we'd have left it there and something horrible had happened, it would have been terrible, but it's so worth it, seeing her like that.
She's going to need a really special owner because, for all sorts of reasons, just practical ones, because she's going to need a fair bit of looking after for a few months yet. And also for emotional reasons. They've put a lot of emotional energy into her.
Thank you.
Thanks.
I want to make sure that she gets the right home, and I think that's really important for them and for Mitzi.
Hi, I'm Dr Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.